Thank you everyone for joining us today here at Aarogram for a session on designing pre-visit patient workflows to improve upfront collections. I'm Shruti Mehrotra, Head of Marketing at Aarogram and host of the Efficient Care podcast. As revenue cycle managers and practice managers, you know just how complicated pre-visit workflows can be. The current system often leads to inefficiencies and frustration for both healthcare staff and patients. That's where we come in. While working on task management apps for hospitals a few years ago, our team, particularly Kashyap, saw firsthand just how unstandardized these workflows were. This sparked the passion in him to find better solutions for a workflow that is riddled with inefficiencies. Arogram's CTO, Priyank, is here with us today too. He has 15 plus years of experience in software engineering and AI products across different industries, serving Fortune 500 companies. I'd now like to welcome Kashyap, who will share more on improving RSIM workflows and offer insights on streamlining your pre-visit processes. Hi, Kashyap.
Yeah, thanks, Shruti. Can you hear me?
Yes.
Yeah, thank you. Yeah, welcome everyone to our very first LinkedIn Live event, from Aarogram, and we hope to do it more. So we're very glad that you are able to join. If you're not, have not joined, this recording will be available on the event page, so hopefully more people can watch this as well. So Yeah, so this event, this session, we have designed for healthcare administrators, providers, practitioners, who who are basically, have a goal to serve the patient. But we also have some folks who are serving other providers, so it could be also relevant to them as well. And the topic today here is the pre-visit workflow. And this is very critical when it comes to serving the patient because it's the first touch point the patient experiences when it goes through the healthcare journey. And for the healthcare provider like you, it's very critical for revenue cycle management because uh, that's gonna, if you get it right, it's gonna get a lot of things right down the stream. If you get it wrong upstream, you're gonna get it wrong downstream as well. So, but in this today's session, we're gonna particularly talk about mostly the patient side workflow. Although it also matters for the insurance payment as well. But the patient side, it's where the things are not standardized, and and still, we work with a lot of providers at Aarogram, and we hear how they do things. So we have really good vantage point about what things work, what doesn't work, and we are trying to innovate in the space so that we can streamline those things for the providers when it comes to patient workflow. And so we're gonna focus on that, but it is extremely important for revenue cycle as well, but for the payment patient insurance payment as well, because as you know, more than 50% of errors in that result in denial come happen like at the early stage at the front end of the revenue cycle. So let's dive in, and hopefully you can gather some good ideas and practices to implement at your setup at your practice. So let's dive in. So yeah, first we need to understand. Let me highlight the screen. Okay. So first we need to understand how the current workflow is broken, and we have put together, all the problems we have gathered from talking to different providers. And it's likely that for a particular provider, it may not be broken all the way. Maybe you are facing some of these issues. Some of the issues, is you have already got handle on it. But when it comes to, when patient comes to you or as a provider, like, the very first thing you have to do is to verify the insurance, right? And when we started out building this product, we thought, okay, how hard it could be, but we quickly realized, like, there are a lot of complexity nuances as you go deeper and deeper into it. And the very first problem is, like, the benefit information is at the granularity that you need is not easily available. And so the staff, or the front desk, have to call the insurance company and get the benefits verified, so that they could um, you know answer the patient's questions. How much is going to be covered by the insurance, how much is the patient responsibility. And if you were to collect upfront from the patient, that also matters, how accurate that information you get. And that is where, we saw that that is unfortunately not streamlined and not automated, and it's highly manual and takes a lot of resources on the provider side. And that results in the loss of patient revenue, especially, but also insurance payment as well. And a lot of patients, because of this process, they end up either canceling the appointment or not showing up for the appointment. So that's one of the biggest problems we hear from our providers. And of course, it depends on what type of provider you are, what specialty or what kind of services you provide. But for the industry insiders, it's a very common problem. It's low patient collection that is resulting. And uh, even the payer has started using AI to deny a lot of claims. And so as a provider, you want to be prepared for it. And uh, if you ask anybody outside of the healthcare industry, and if you tell them, okay, you are running a business, and if you don't know how much you're going to get paid, how much the customer has to pay for their using services, and how much as a business you're going to get earn, if you don't have clear idea, then how can you run the business effectively, efficiently, right? So that is something, otherwise you would take it for granted. But for healthcare insiders, like somebody who doesn't know the nitty-gritty of healthcare, they would be very surprised to know, okay, this is the reality that exists as of today. When you are running an organization, you're running a kind of business, so to speak, and you don't know, where how much revenue you're going to get, how much payment you're going to get. And that is very challenging for you to run your operations, right? So, and the impact is real. We have heard that, we saw that there's a less than 50% of collection rate, and that is even becoming more important with the how the payer is shifting the design of the plan. So earlier it used to be like 5 to 10%, would be the patient responsibility. Now it's going 30-40% because of the high deductible plan design, or maybe because of the how the co-insurance and copay are designed. But in either case, it is very important to get the patient collection right. And it also matters for the patient as well. You would think, okay, if it's a problem for provider, maybe patients are fine, but like patients equally problem. So it's kind of lose-lose situation for both provider and the patient. And so it is a real problem. So what we are planning to do here in this session is that, okay, there are a lot of tools out there exist to collect the payment from the patient, to even have those integrations and even get the high level benefit info. But ultimately, um, what we are missing is the information about the certain nuances. So that's what we're going to cover today. So we're going to cover three big topics, and then offer kind of solution, how we can address them. So the first thing we're gonna tackle here is the benefit verification bottleneck. And as I just described, it's still stuck in the old age. And okay, you can get some information online, but it's overwhelming. It's not clear. Even from the other PM systems, you don't get at a CPT level, you get at a service level, and that ends up costing a lot of human efforts and probably the lost revenue as well. And these are like real numbers from our experience. Like it, it's very common for provider staff to be put on hold for an hour or 2 hours if you're lucky, to get the information that you need. And that is you have to figure out, if you are, or if you have somebody whose staff, let's call her Mary, is working for 25 years and knows how exactly to map the benefits, how get the uh, mm, uh, benefits confirmed, then you may get answers quickly. But if not, then how do you do that, deal with these things? Because eh, if you go into detail, like, it is very complicated process where you don't get at the CPT levels. So then with the rise of AI, we could totally automate it, and we could do it with um, you know the with using AI. It was earlier, we Mary has got experience, so has got some rules and heuristics about how to interpret the benefits. So similarly, we are also training AI, and AI can do those type of task right now at this in this age, especially after the rise of generative AI. So we thought, okay, why not utilize it and see how we're getting. And we are actually able to automate a lot of things, and this is kind of uh, uh, we are putting in a production. We're seeing a lot of accuracy. So but under the hood, a lot of things are happening. It's like the AI is also mapping the benefit terms to the services types to the CPT code. It interprets the benefit, it understands what the description says. It also considers the provider profile, the patient profile. But unless you get the provider profile right, you can't get the very mm, good accuracy, right? And we are also put in a lot of subject matter expertise by processing thousands of patients. And it also considers automatically the coverage limitation exceptions, and determines accuracy and confidence. If you don't have accuracy or confidence level, then there's no kind of use. You still have to put manual effort. So okay, you could automate it. It saves time. It is real time. But the interestingly, there are other second order effects, and the effect is, there's a paradox called Jevons paradox, which actually specifies, like, if you increase efficiency of a system, um, a resource, it will actually generate an increase in resource consumption rather than decrease. So what we are saying that, okay, if you could automate it, you could actually do it multiple times. So it's kind of multiple checkpoint system, because that the patient journey is long. So a traditional way you do is just do one time, maybe before the day of appointment or on the day of appointment. But now imagine you could run the system because it's available 24 by 7, and you could use that information to triage even before scheduling the appointment. And you can use that information to build a patient confidence, and even do the multiple check along this way journey, so you get the latest benefit, because the benefits could change. So that is now possible because of this kind of AI system that could automate this thing and do this with reliability, right? That is very important. So now the second thing we are saying, okay, benefit after benefits verification, like, where is the gap? Like, you have to go from benefits verification to all the way to the payment collection. All right, so where is the gap? So the gap is how you take those benefits, and how you take those benefits, and then use that information to actually figure out how much you're going to charge patient upfront with confidence. Okay, so right now we talk to a lot of providers. Some providers say, okay, we just collect copay, and then other providers say, we just collect co-insurance. And we would ask, like, why? And they say, because it's just the easiest way to figure out. We don't have to do it. But that doesn't necessarily result into good accuracy, and that means they have to either they over collect or under collect, and that's still a problem. And because it's not giving confidence to patient, it's increasing workload for you. And if you don't collect at all, then it's even more work. And if you don't even inform the patient, and that is also kind of uh, not good for your workflow. And some providers say, okay, but what if I share upfront pricing with the patient, and what if the patient goes away? Then we ask them, like, would you rather prefer to share the patient or find out the financial options if the patient wants to do it or not, or do you rather provide the service and then chase the patient and the insurance for the payment, right? And ultimately it's a question of trust, and that is the third point. We're going to talk about the price transparency. But yeah, let me go back to this. Is that getting the patient estimate? Okay, what after that? After that is how you communicate with the patient, how you communicate with the staff, and that is how you can actually integrate in your workflow. So this kind of system, AI system such as Aarogram, if you could get the verification done in real time, if you get the estimate, if you can also get the communication right, with the patient, then it actually helps you to smoothen out the process to collect the upfront payment with confidence. So you don't have to go like random rules. Okay, if this is insurance, collect this. If this is plan type, collect this. If collect only copay, collect only co-insurance. No, no. Like you could actually collect with more confidence, and if you have more confidence, you can also give that confidence to the patient as well. And that is the price transparency. The last point is where, as I said, it is actually ultimately about building the patient trust. And yeah, trust matters to build with the price transparency, but now it's also regulations introduced, like something called No Surprise Act, you're probably aware. So it's been effective since 2022, and it has got bipartisan support, and it's probably gonna be more enforced going forward. And a lot of providers are already trying to fulfill the requirements. And but it is, rather than, it's also an opportunity. When there's something new regulation comes, it actually gives you opportunity, because it sets like level playing field for everybody, so everybody has to share prices. But then if you are the one who is doing well, who is keeping in with the patient's interest in mind, then you have that competitive advantage. So you can be ahead in terms of establishing trust with the patient, especially if you are like independent specialty group practices, where maybe you are competing against big healthcare systems. That's where you can actually build trust and you know provide more confidence, so that patient would prefer you instead of going to a big hospital system where it's the kind of, they don't have get this kind of help, right? So that is an opportunity. And how it uh, could look like, okay, well, this is could be the futuristic so-called workflow, where imagine like you have a website, and a lot of providers actually tell us that okay, they get referrals for specialty, but like a lot of patients actually come via website, or they at least check the website. And that's why they have the tools like patient portal or payment gateway or other things on the website. But something like cost estimator, if imagine if you could put on a website, patient can go there, do the self serve, they can put in their insurance details and get the estimate. So that would be really like upgrade in the patient experience. And it is kind of no brainer, but unfortunately this reality doesn't exist right now. And it's very different from other industries. Like if you go to a restaurant, and if you don't know how much the food gonna cost, so this is like getting a menu up front, like, okay, you're gonna get this item, this is how much it's gonna cost, how much you're gonna pay. So that is what is expected even in other places, in any other service business, any other professional service business. So why not in healthcare, right? So it's a win-win situation. It could for the patient as well as for the provider. And so we talk about the estimate, we talk about benefit verification, but the real power is the power of the knowledge, the power of the information. So that empowers the provider to act on the information, to act on the knowledge. And how you can act on it? Well, first, you can definitely build patient confidence with price transparency. Second, you can collect the upfront payment with more confidence, more accurately, so you have less, uh, you know, work going back and forth with the patient, adjusting the payments. So, and it could differ provider to provider. Some providers, prefer to disclose the estimate, but then they get the patient sign or consent or credit card information. So that is fine. Provider can have their own workflow. I can understand. There are different setups and different contexts, right? But then if you get the information, get the knowledge, then you can act upon it. You can streamline the patient workflow, and you can also streamline even the appointment as well, because no shows and appointment cancellation is another problem that a lot of providers are facing. We are seeing, and they're asking us for solution. And when we go a little bit deeper into it, like why are they canceling? Like maybe the patient hesitant. And why is the patient hesitant? Maybe the patient has got healthcare problem, but plus also have anxiety. Plus, to add on top of it, the patient is worried how much going to cost me out of pocket, and all of the things. So patient is looking for answer. Patient is looking for assurance. So how do you provide it? And ultimately, it's patient's choice, patient's freedom. If there is a non-emergency elective procedure the patient wants to get, maybe the patient wants to plan as per the deductible amount that they have remaining for this year. Maybe you want to inform patient, okay, the end of the year the deductible is going to reset. Why don't you come and see, the procedure, the procedure test that you've been waiting for a long time, right? So there is an opportunity to act on the information, and ultimately it results in improving the upfront collection for the providers. So that is how we can see the value. And I know there's a lot to talk about this topic, but we are keeping this session open for questions later on. But first I would like to uh, do a quick case study. So I'm going to invite my co-founder and CTO, Priyank, to cover this case study and see how it kind of resulted in real life impact and with one of our clients. So yeah, Priyank.
Hey everyone, nice to meet you. All right, so I'll quickly go to this case study that we have done with our one of our customers, early customers. So they have about 2,500 patients a month, and their turnaround time for finding out if patient has active insurance, if the benefits are covering the service provider, and what is the estimation of the patient responsibility. In order to get these three answers, it was taking them 2 to 7 days per patient. They were spending about 10 minutes per patient for simple ones, and then complex insurances they had to spend 20-30 minutes per patient. So it's a domino effect. In order to serve about 100 patients a day, they were falling behind. They were always 7 days behind across their locations. So using Aarogram, now they are able to not only get all these answers in pretty much real time, but also they have, let me give me one more second. Yeah, they are getting all these answers within 60 seconds. In other words, they get a call from patient, they are able to find out if the insurance is active, what are their benefits, and what are the patient's responsibility for this appointment, and how much insurance will be paying. All these at their fingertips within 60 seconds. And with this, they are able to check benefits not only prior to scheduling, right before the appointment, 24 hours before the appointment, to make sure that deductibles remaining has not changed, or out of pocket maximum has not changed, or benefits have not changed, and so on. They can also add more feedback to it based on their historical claims data and whatnot. And this is the power of AI that helped one of our customers to increase 18% in the patient payment collection. If I were the patient, I would be more confident if I know the price that I'll be paying. And as a result, their revenue collection increased by 18%. And on top of that, their staff is now, focusing on other revenue cycle management tasks because their effort in getting the patient estimates is reduced by 80%. One of our customers had 4 staff members doing benefit verification, price estimation, and prior authorization. Now only one person can do it, and they are helping out speed up the revenue cycle overall. So they have less claims denial and more patient collection upfront. Happy to take any questions you guys may have.
I think you are on mute, Shruti.
Sorry. Yeah, there are some questions in the chat, and I can help you out with that. There's a question for you, Kashyap. Uh,
Mhm.
this person asks, could you elaborate on the specific ways in which AI tools, such as yours or any other, adds on to the services of a billing company?
Yeah, sure. So, you know, from the very beginning, like we've been very flexible in terms of how we fit in the workflow. So we have the full platform if somebody wants to use it, like on self-serve mode. So we have like a design built out the whole platform. They can use it with their staff, or if there's a billing company, or even if they want us to provide the virtual assistant service, we are also flexible for that as well. We're also flexible to integrate with other system with the API connectivity connections, both ways, one way, two ways, patient tech as well as putting the output as well, because we understand that the providers have their own workflow, their own tools, so they want to integrate, and that is why we have made this system very flexible, and we have that advantage because we have like a specific point solution, and that can um, fit in the way that will require minimal behavioral change. So yeah, that's how I would answer.
Yeah, thank you, Kashyap. We have a question for you as well, Priyank. Laura asks, could you provide a more in-depth explanation of how this AI technology works in practice, specifically for generation of patient-specific cost estimates?
Fantastic question. Yeah, definitely. Thanks for going back to that slide. So the AI works. One of the foundational thing it does is it connects you with all your peers. Number one, and brings all the information about the patient. Second piece, it looks through all your fee schedule, negotiated cost across different insurance provider. But on top of that, third thing is AI has all the subject matter expertise that your most experienced staff member would have. Or the person at insurance company who is receiving your call, hey, I would like to get the benefits for this patient. These are the information about this patient. And what would the copay apply? What would be the coinsurance applied to this CPT code? And those answers are coming from very experienced individual on the support line from insurance company. We have all these subject matter expertise of insurance company individual as well as your most experienced staff member, and we have fed that subject matter expertise into our AI models. And our AI model is not only working on the structured information, but also unstructured information. By marrying these integrations to get the fee schedule, benefits, and the subject matter expertise through our AI models, we're able to get the answers in fraction of, in few seconds. So that's how we're layering details on top of each other. We have another layer of AI that we're adding right now is we're putting some of the claims data on top of that too. So we can learn from your historical claims data, how much payments you have received for the similar claims in past. And the AI makes it not only faster, but it gives you answers that are related to fuzzy questions. not every single staff member is experienced to answer all these questions, but what we're doing is we're taking all this knowledge and our experience of processing tens of thousand patients and putting it through our AI model so it can consistently answer the questions with highest accuracy, and our accuracy rate right now is 95%. Hope that helps.
Thank you, Priyank. Thanks for the answer. Um, Thank you so much for all your wonderful insights today, Priyank and Kashyap. That was a very lovely session. For all our attendees, I'd like to share that we have a newsletter on LinkedIn that you can follow us at. It's called The Efficient Provider, and we have a podcast where we host a ton of wonderful RCM experts sharing their insights with us. And please feel free to reach out to Kashyap, me, or Priyank with any questions you may have. And do check out our website as well. Thank you so much for coming
Set
to
up
this webinar.
set up a personalized demo if you're interested for a product.
Yes, love. We also do personalized demos, so we would love to hear from you.
Yeah, thank you very much, everyone. Everyone, this recording will be available on this um, link of the event, and Shruti or I will also share the links of this all the resources podcast and website as a comment on this event page. So, thank you, everyone. Have a good
Thank
one.
you.
Thanks, everyone.
Thanks.